These people are in dire need of help. Their medical condition, the complications from simple diseases that can be prevented with just some attention. But if you don't do that in a timely manner, things start to become really difficult.
Floods across the country have now killed more than 500 lives.
Tremendous suffering, unspeakable suffering.
Assalamu alaikum wa rahmatullahi wa barakatuh. This is your brother Javed Siddiqui, CEO of Helping Hand for Relief and Development. I'm coming to you from this camp location, this medical camp that we have set up for Helping Hand and Relief and Development. We are about 35 kilometers from Mirpur, Khas in interior Sindh. It's a very remote area which you rarely see any services or organizations working in this area. And I've met so many amazing people here. I just want to mention one person, Dr. Shagufta, 28 years old, young lady who has been part of almost 27 camps, really risking her life, being in harm's way. She's here taking care of these very people who has nothing going on for them. I was told that there were about 8 feet of water here. Water has finally receded in this area, but we are starting to see a number of diseases. We have a dentist, a skin specialist, multiple physicians, a gynecologist, and medical services, testing services. We have on our left side here this mobile unit, which if the camera can show you that direction here, we're using it for testing purposes. There's a number of tests. I won't be able to repeat those for you, but we looked at the number of tests that they are performing. Brothers and sisters, the conditions are really difficult. Helping Hand and others are trying their level best to be able to bring some relief to these communities who've been really harmed in so many different ways. I mean, the number of diarrhea cases, the number of skin diseases. The dentist was telling me that they're actually starting to see a high number of patients they are suspecting that may have dental cancer or tooth cancer. So, and then we also spoke to our gynecologist, and she was explaining to us that it's very difficult, especially when it comes to giving medicine and having follow-ups with them. So there's lots of challenges, but alhamdulillah, I would want to say, according to the people who I'm speaking with here, they're saying conditions are getting better in terms of the surrounding area, but these people need constant care for months to come. And we look forward to your donations, we look forward to your support for this work. So please continue to support these efforts. These people are in dire need of help. Their medical condition, the complications from simple diseases that can be prevented with just some attention. But if you don't do that in a timely manner, things start to become really difficult. And they don't have the facilities or larger medical complexes around anywhere near. I asked the question, why did we set up a camp here? And I was told there are like about 8 or 10 villages, smaller villages that are in the surrounding area. And this location was one of the most convenient locations for them to be able to come here. Remember, these people don't have cars or maybe a motorcycle or motorbike. But for the most part, if someone is sick, it's a convenient location, and we're doing what we can. So please keep them in your dua, and we would love to, inshallah, continue to work with you to support these communities and truly, truly deserving people. Jazakumullahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.